Yesterday, I talked about the fact that there were 2 deaths reported in Pennsylvania. Pennsylvania now has 424 cases of measles. It's basically the hotspot in the country. A lot of it centered in Lancaster County, but also now in Western Pennsylvania. Jefferson County is becoming another hotspot and was responsible for at least one of the cases diagnosed in Pittsburgh. I want to talk a little bit about the deaths because there's been a lot of disinformation out there and also a massive information vacuum that allowed the anti-vaccine movement to basically seize upon it because we didn't have much information on the 2 people who died. So what we know now is that these are what are called measles related or measles associated deaths. That's what the Pennsylvania Department of Health is saying. That means that these are deaths where measles was diagnosed but wasn't deemed to be an immediate cause of death. We're hearing from the Lancaster County coroner that he is investigating an infant who died of a splenic rupture that tested positive for measles. Splenic rupture is not usually associated with measles. Splenomegaly or a big spleen is not also associated with measles. I don't know where that one is going to fall. I don't know anything about the second case, but I think it really is important for the Pennsylvania Department of Health to be very transparent about these cases because the anti-vaccine movement is really using this kind of vacuum, this lack of information to put forward lots of disinformation. And it doesn't help if you have the governor saying that these are preventable deaths, but then the state is classifying them as only measles associated or measles related. And you have the county coroner in Lancaster County, where these deaths likely are related to, saying that we have none. This is going to be something that I think is exactly how I would teach it if I were teaching public health communication students how not to do this. And I think it's an unfortunate, unforced error. And it's much better to actually be transparent than spending your time trying to score points against RFK Jr. This is an operational response, and I think that we need politics from both sides, from Democrats and Republicans, to be removed from this and actually allow public health workers, infectious disease physicians to do their work and try to get control of this outbreak as quickly as possible. Because as we know, in Pennsylvania, as school is starting, the number of vaccine exemptions has tripled. So we are likely to get more cases. There's one actually in my home county, Butler County, that was diagnosed. Thankfully, Butler County has a pretty high kindergarten vaccination rate, 93.1%, not quite 95%, pretty robust. And hopefully we don't see spread there.